Media friends, good morning. Welcome to the 11 a.m. press briefing. Today, besides the Chief Executive, we also have the Secretary for Food and Health and the Secretary for Civil Service. In a moment, the CE and the two secretaries will give a speech, and then we will take questions. Because of the epidemic, please keep your mask on and maintain social distancing. Now we will invite the Chief Executive to give us a speech. Good morning, members of the public and media friends. I hope that every one of you has done the RAT this morning. Starting today until the 10th of April, that is 3 days in a row, the HASAR has been encouraging everyone to do a RAT per day so that we can identify all the hidden infections in the community through RAT and arrange for the appropriate treatment, isolation, or home support for these patients so as to cut the transmission chain. And this will give us a better picture of the infection situation in the community, and then we can plan for the next stage. So I call for everyone in Hong Kong to support our campaign. If you have used up all the RAT kits in the service bags, you may go to the 89 distribution points all over the territory to get additional test kits. In yesterday alone, 110,000 RAT kits have been distributed to people as these are service points. We welcome citizens taking the bags and do a test at home. Now today is the 26th daily press briefing since the 9th of March. Among the 26 press briefings, 5 briefings were on the treatment work for COVID patients. 3 briefings focused on the vaccination program. Today, the two secretaries with me will also talk about the vaccination program. At this point, I don't think anyone will doubt the importance of vaccination. There is a consensus that it is the key tool for reduction of severe cases and death. Because of its efficacy in reducing hospitalization and severe cases, a higher vaccination rate will spare our public healthcare system from catastrophic pressure. In order to, by keeping our public healthcare system sound, there will be more space to relax social distancing measures. To encourage vaccination uptake among the public, a few months ago we launched the Vaccine Pass scheme. The Vaccine Pass scheme will be more widely applicable to different premises and workspace in Hong Kong. Given that there is no rebound by the 21st of April, we will relax most of our social distancing measures by 3 phases in 3 months' time so that people's livelihood can return to normal. At that stage, we will rely on the vaccine pass to give us protection. As a result, on the 30th of April, the requirements will be 2 doses. By the 31st of May, the vaccine pass will require a 3rd dose. 2 days ago, the experts were of the opinion that it is time to administer the 4th jab for high-risk people. In a moment, I will invite the Secretary for Food and Health to shed more light on that, and then the Secretary for Civil Service will summarize our vaccination work in recent days, especially for elderly people and the young. Now, Secretary for Food and Health, please. Thank you, Chief Executive. Good morning, media friends and members of the public. Drawing from the experience globally, as well as our own experience in the 5th wave, vaccination plays a key role in controlling the epidemic. The Hong Kong SAR government has been consulting our experts depending on in view of the development of the epidemic to roll out the best vaccination arrangement for Hong Kong people. In the past Wednesday, that is the 6th of April, the scientific committees, that is the Vaccine Preventable Disease Committee, as well as the Zoonotics and Disease Committee under the CHP, together with the government's experts committee, met online to discuss the vaccination measures. Now I will report to you their collective recommendations. Now, on vaccination of the 4th dose for elderly people, the Joint Scientific Committee has learned from local data that for all adults age group, for 3rd dose, whether it is Comirnaty or CoronaVac, they are all highly effective to lower the hospitalization and death rate upon infection. Vaccination can prevent serious illness as well as comorbidity and complications after infection. Based on the hospitalized cases number, among the critical and serious patients, as high as 59% were unvaccinated. 23% were vaccinated with 1 dose only. 15% were vaccinated with 2 doses. Only 3% were vaccinated with all 3 doses. It reflects that COVID vaccination is effective and has an obvious effect in reducing serious cases. For 2 doses and 3 doses receivers, the mortality rate is much higher than the unvaccinated population. Since the outbreak of the 5th wave, that is between the period between the 31st of December 2021 and the 6th of April 2022, 70% of the diseased patients were unvaccinated. 40% of the diseased patients received only 1 dose. 11% of the death received 2 doses, and only 1% of the diseased patients received all 3 doses. In other words, recently, for every 10 people infected with COVID and passed away, around 9 persons were unvaccinated or only vaccinated with 1 dose. Under the 5th wave, most of the patients who passed away were above the age of 60, accounting for more than 95% of the fatality. In view of that, experts recommend that for those above 60 who have received 3 doses already, that at least 3 months after the 1st dose, they should be given another jab, that is the 4th jab, whether it is a Comirnaty or CoronaVac, for enhanced protection. The same principle applies to those who have been affected with COVID-19 and recovered and above the age of 60. Second, for those who have recovered from COVID-19 disease, experts do not object that for personal reasons, for example, overseas study and traveling, to receive the next jab after 28 days. For those unvaccinated and recovered, they can receive the jab no sooner than 1 month after infection. Experts are of the opinion that recovered patients should be subject to vaccination just like the uninfected, and no screening is required. And to enhance administrative efficiency, we have provided for some flexibility. So experts do not object that with the agreement and consent and with the agreements with the public, influenza vaccines and other children vaccines that can be administered at the same time.
The SAO government will be administering the shots on scientific basis and having regard to COVID, we have lowered the age for vaccination to 3, as per the expert advice. We're grateful to the experts for their invaluable comments and input with a view to protecting public health. At the end of February, we started the vaccination program for COVID. The supply of the vaccines has been stable. We have numerous channels for vaccination. We have the community vaccination centers and various other points. We also have the outreach vaccination teams, and I hope that the members of the public, in particular those in the older and younger age brackets, they should get vaccinated for the different doses. For the elderly population, the vaccine coverage has increased gradually. There are still 370,000 of people aged 60 or above who are unvaccinated. And I'd like to take this opportunity to urge the senior citizens to get vaccinated. Even with one shot, there will be protection. And the second, third, and fourth doses will go a long way to reducing the chances of death and severe cases should one get infected. So for the sake of your health, please come together and get vaccinated. Secretary for Civil Service, fellow citizens, friends of the media, I'd like to bring you up to date on the vaccination program, and also for those above the age of 60, and we're going to have the arrangement for the 4th dose, and also the vaccination situation in the care homes and the outreach vaccination situation. Now, let me give you some numbers. As of last night, 15.36 million doses have been administered. Those about 16 to 6.21 billion have been vaccinated, or 92.3%. 3 to 11, more than 320,000 have been given the first shot, taking up 61.8% of this age bracket. If you take the number above the age of 3 in terms of one shot, we have 6.64 million citizens who have been vaccinated, taking up 90% of the population in above the age of 3. So 90% have already got the first shot. For those who have had the second shot, the number stands at 5.76, or 85.6 of the total population. Those with 3 shots, the number stands at 3 million, or 2.91 billion. Now, after 3 months after the second shot, one can have the 3rd shot. Those who are eligible for the 3rd shot, the vaccine coverage is more than 60%. Those above the age of 60, if they have had the second shot 3 months ago, the vaccination rate is 76%. That is for those above the age of 60. 1.7 billion who are eligible for the 3rd shot haven't really got the 3rd shot. They may have taken 2 shots, and some of them got infected, and they don't need to have the 3rd dose. So in terms of numbers, there are 1.7 billion people above the age of 60 who are eligible for the 3rd shot. Now, for the daily vaccination numbers, over the past 7 days, rolling average, the number stands at 34,000 per day. And our capacity per day can be 100,000, and the 7-day rolling average is 34,000 only. So we have a lot of vaccines waiting for the recipients. It's like Q4 last year, prior to the outbreak of the 5th wave. So this is something that I'd like to draw your attention to. If there is an outbreak, it would be too late to get the vaccination at that time. So we do have the vaccines available, but the vaccination per day is actually lower than the capacity. According to the Joint Scientific Committee, they have reached the consensus on Wednesday for those aged above 60 with 3 shots, and for 3 months, they are eligible for the 4th shot, either Sinovac or BioNTech. So for those who are eligible, those aged 60 and above, they can turn up at the community vaccination center or the vaccination stations at the public hospital to get the 4th shot. We have the online appointment system, which will be updated on the 14th of April to allow those aged 60 and above and who have already had 3 shots 3 months ago. They can make the booking online to get the 4th shot. There are 7 community vaccination centers doing Sinovac and 16 providing BioNTech and 13 vaccination stations of the hospital authority that provide a same-day ticket for the 60-year-olds and above. So in terms of vaccination, the senior citizens don't have to be worried, and they don't even have to queue up. They can get a same-day ticket. According to our information, from today, as of today, 190,000 people above the age of 60 who have already had 3 shots for 3 months. And these people can go ahead and make the booking for the 4th shot. As to care homes vaccination, our first target was achieved on the 18th of March. The outreach vaccination team have already provided the vaccination, the first shot to 1,100 care homes, and we have achieved the milestone there. Now, what we are working on at the moment is to arrange for the outreach team and also the attending doctors to arrange for 2 rounds of outreach service before the 15th of April to administer the first shot for the residents who have already been infected, and also the 2nd and 3rd shot for others. And arrangements made for the outreach work. As of the 4th of April, more than 45,000 residents who have been administered the COVID shots by the outreach team, or some of them made their own arrangement to get vaccinated at the vaccination center. The vaccination rate is 60% there. Now, some of the people got infected, and it's not time yet for them to get further shots. And also, starting from the 30th of March, we have, on a pilot basis, provide a vaccination program for the lockdown buildings. On the 2nd day after the lockdown, for those who are aged 17 and above, who have mobility problem, they are provided with the on-site vaccination service. If they test negative, we will be dispatching the outreach vaccination team to administer the shots, so they don't have to be worried about going to the vaccination centers. I've been to some of these buildings to see for myself this kind of service.
Through district organizations, We have collected information about potential service recipients. If the locations or the addresses are near the RTD buildings, then the outreach teams would also visit them and get them vaccinated. Now, the vaccination at home service requires a lot of manpower to get the first jab administered. So here are some figures. Between the 30th of March and the 7th of April, the trial vaccination at home scheme has provided provided jabs for registered persons in 6 building blocks, and 19 persons received the first jab. Among them, 16 were aged between 65 and 98, and 1 was eligible household member. 3 persons were people with disability or mobility problems between the age of 14 and 46. 9 persons have registered for the vaccination at home service. Because of infection and unwellness, they were not eligible to receive a jab the day after the RTD operation, and more arrangements will be made for them. So we have been collating our experience to rationalize our future arrangements. And also we will open our online platform for registration, and we will also set up hotline services to receive application for jabs at home. Now, we have entered the final stage of preparation, and the scheme will be fully commissioned over the territory by the end of April. We want to provide a vaccination service for elderly people aged above 70 or those immobile people because of various reasons. We want to get as many people as possible jabbed. We urge family members, if you can take your elderly household members to get jabbed at our mobile vaccination stations, please do not wait, and please do so quickly. Now, like Professor Chen mentioned, vaccination is really effective in reducing the risk of serious infections, serious cases, and deaths. The mortality rate for unvaccinated people is much higher than those vaccinated. So for those of us who love our elderly household members, please arrange vaccination for them as soon as possible. The protection of vaccination would diminish over time, so please get the 2nd, 3rd, or even 4th jabs according to the timetable recommended by the experts. The vaccination program is a marathon. We have yet to reach the finishing line of the fight. However, it is clear that vaccination is the most crucial, or if not the only way for us to emerge above the epidemic. So we have to fight on and get people vaccinated. We have ample vaccination capacity. We have sufficient vaccination centers. A lot of healthcare workers and volunteers have thrown in their support. So let's work together and fight against the epidemic. Thank you. We will take questions now. Now, this is the Q&A time. Please raise your hands and please identify your media organization and use our microphone to ask your questions. The lady in the middle. Good morning. I'm from TVB. Mrs. Lam, the State Council has approved John Lee's resignation. However, no replacement candidate has been mentioned. So what do you think? There is only 2 months left for this term of the government. If the position of a chief secretary is not filled, then we will affect the operation of the government. About the chairmanship of the CRC, the Candidate Eligibility Review Committee, if not chaired by the chief secretary, then who? On your first question, yes, the Xinhua news agency has announced that the State Council has accepted my recommendation under the Basic Law to relieve Mr. John Lee of his position, of his duty as the Chief Secretary for Administration. The HKSAR government has issued a press release as well. If you remember, at the same occasion yesterday, in answering a similar question, I have detailedly explained the arrangement under Article 48, brackets 5 of the Basic Law. The chief executive has two duties. First, nominate to the central government the appointment of principal officials. Second, recommend to the central government to relieve principal officials' duties. So on the second point, that is the relief of Mr. John Lee's duty, it has been approved by the State Council. However, for the first point, that is my nomination of principal officials for the central government to approve, or acting arrangements concerning the chief secretary's position for the next 3 months, I have not received any notifications yet. In terms of appointments or acting, I think we have to take a comprehensive consideration. Of course, the chief secretary plays a key role in fighting against the epidemic. He should be the coordinator among bureaus and departments. So without the chief secretary, it would affect our work to a certain extent. However, like I explained yesterday, the work will be done. Especially, I have been the chief secretary for 4.5 years. So I don't think the arrangement will pose a serious problem for the remaining terms of the government. I'm just answering your question hypothetically. In the lack of the chief secretary or an acting chief secretary, what will the arrangement be? The statutory powers assigned to chief secretary, some are written into law. However, the chairmanship of the CERT is not written into law. Under our law, the chief executive would appoint principal officials and non-officials to form the CRC. For officials, they must be principal officials nominated by me under Article 48 of the Basic Law and approved and appointed by the central government. The number is 2 to 4. It doesn't specify who should be the chairman. True, there are only 2 principal officials left in the CERT after the resignation of the chief secretary. The position is not filled yet. And earlier on, after when the Secretary for Home Affairs resigned, there was an acting arrangement in place, so it doesn't meet the requirements under Article 48 of Basic Law. So the number required is 2 to 4. I'm looking into appointing at least 1 more principal official as a member of the CRC. We have 3 non-official members. So it doesn't seem appropriate if we only have 2 principal officials in CERT. I will announce in due course the principal official appointed to join the CRC. We have a lot of eligible candidates because we have a lot of principal officials appointed under Article 48 of Basic Law.
There is administrative work undertaken by the CS, like the chairing of meetings and also the coordination of the 25A, the 25th anniversary of the SAR. And the relevant officials are taking up some of these work, and I will be taking over these work if necessary. Next, please. The gentleman to my right, in the middle. Dot News. The government is launching the mass testing exercise. What's the response going to be? Do we expect? And the distribution of the anti-pandemic service packs, how many have been distributed and how many have yet to receive, and how to support the singleton elderly to undertake the RAT test. And for those aged 60 and above, if they have they have had the 3 shots for 3 months, then they will be getting the 4th shot. Are you going to have the 4th dose for the whole population? And what is the supply like? And do you have a plan for the universal vaccination? Right. Regarding the RAT mass testing, I'll be saying something about it, and Professor Chen will be talking about the vaccines. For these 3 days, we are encouraging the whole population to take advantage of the RAT kits provided in the anti-pandemic packs to undergo the self-testing. This is a voluntary exercise. If one tests negative, there is no need for declaration. It's only the positive results that need to be declared. We're not going to be certain how many people will be taking part. And if you ask me, of course, I would hope that 7 million people will be taking part. The whole idea is more like to take a snapshot about the situation regarding the pandemic, and also to help us identify the asymptomatic patients, so that we can arrange for isolation, home isolation, or other forms of isolation. And it is for these purposes that we'd like to have more taking part. Otherwise, it will not be complete. So I'd like to make the plea again, and I hope that all of you in the audience would have done the RAT test, that we all would very much like to start the 3-month, 3-phase relaxation of the social distancing measures starting from the 21st of April, so that we can be on our way back to normal. And we hope that we can achieve zero COVID. And if we can cut off all these transmissions, chains of transmissions, we will be able to achieve that. So an RAT test would be a very simple exercise. It would take a couple of minutes. If you wait for the line or lines, it would take just a couple of minutes. Don't have to venture out or queue up. All these packs have been dispatched to people's doorsteps. Now, let me say to you some numbers why it is worth doing it now. I cited the rate quoted by the Hong Kong Youth. They've identified 10,000 people who did the RAT test, and that gave us some ideas about the infection rate in Hong Kong. The latest number, as of April 6, the infection rate is 0.56%. If you take this 0.56% in the context of 7 million population, we are talking about 40,000 people. Now, for these 40,000 people, they include those who have been infected but have yet to recover. So the RAT test will still be positive. Assuming that a quarter of these 40,000 people are infected and they are on the way to recovery, now, And we have 3 quarters. There's about 30,000 people. And if we take a snapshot, there are 30,000 people who are infected without them realizing it. If we can tease them out and arrange for treatment and isolation and issue the isolation order, their close contacts will be issued the quarantine orders. They're not venturing out. Then we would stand a pretty good chance of snapping the chains of transmission. Why is it not worth doing it? I think it's well worth doing it. That's why we have dispatched all these supplies. We have mobilized 10,000-20,000 volunteers, and all of our colleagues are putting in the efforts to distribute the supplies. If people have to come out and queue up for the packs, then people can be bothered. So to answer your question, as of last night, we have distributed the supplies to 2.7 million households. We have distributed 3.05 million packs, and if they have a household of 4, 5, or 6, we would give them extra packs. We have the 89 service centers, 50,000 packs have been distributed, and 16,000 of them turned up with the card that they were left them with. These are people who were not there when we knocked on the door, and 35,000 just walked in to say that they want the service packs. And we just asked them for some information and made available the packs to them. There are some who go to the service centers for the RAT kits, and 110,000 kits have been distributed. So we have ample supplies, and I urge everyone to undergo the tests for 3 days in a row. That would enable us to cut off the chains of transmission and put ourselves back on the way to recovery. Professor Chen, there are 2 questions there. The first one is whether we have to administer the 4th shot for the whole population. The Joint Scientific Committee had regard to the data in the light of the 5th wave. Now, if you look at the mortality, most of them are at age 60 and above. That's 95%. So for those 60 and above, it is recommended that they have the 4th shot, and the gap should be 3 months. In fact, the whole population have to be vaccinated up to the 3 shots. There are no recommendations yet for the 4th shot. Mr. Patrick Nip has already said that for those who are due for the 3rd shot but haven't quite done so, the number is still pretty significant. So if you are due for the 3rd shot and haven't done so, please come forward and get the jab. Now, for the 2nd generation vaccines, the experts and the Joint Scientific Committee have been monitoring the situation around the world, and also the effectiveness of the vaccines against different variants. Different pharmaceutical companies are in different stages of developing the vaccines, and we will monitor the situation closely if necessary, and if there are certain vaccines that are effective against certain variants, we will be monitoring these and see whether we will be introducing them to Hong Kong. But we will monitor the scientific data all along.
3rd question, the lady in the back. Good morning. Cable News. The mass testing operation today is the first day. Now, according to our survey, 1/4 of the respondents said they won't do the test. So you said you hope that 7 million people would do the test. However, what will be the reality if the effectiveness is if the results is not as good as you expect? Would you require a CUT or compulsory universal testing? Second, Mr. John Lee's resignation has been accepted by the central government. So as his superior, would you comment on his performance during his tenure? And you said that you would announce the appointment of the successor would be announced as well. However, the Xinhua News Agency hasn't made an announcement yet. So who would you recommend to the central government? Well, I hope that your survey is only a temporary. The results of your survey is only a temporary one. If more people are doing the test, it would give us a better picture and also affect our decisions for the next steps. So we will keep monitoring the situation in the next 3 days. The nature of RAT is that we cannot mandate people to do it. It is performed by the individuals, and we would only be aware of the positive results. If we mandate people to report the negative results as well, people would simply not do it. Well, in the 2 years fight against the epidemic, some may think that there are some failings and shortfalls. I admit that there is room for improvement. However, without the support from the public, we simply cannot get there. I think nobody can criticize the government of not not pushing vaccination, especially in the past 2 or 3 months. However, there is simply some resistance. The daily vaccination uptake has been lagging behind. If people are not united, then society as a whole will have to share the consequence. I and my team will continue to fight on until the 30th of June. We do our best to facilitate the participation by the public. For example, RAT is very easy to do. If the public still refuse to cooperate, we can only express our regret. On the second point, I will not comment on it. Like I said many times, before an election, as the chief executive or even principal officials, it is not for us to comment on potential candidates. Thank you. Next question, please. Sorry, I have 2 supplements. So what you described was not entirely incorrect. Was not entirely correct. You said I would announce the appointment in the same go. That's not the truth. I said I have tendered the arrangement together with the resignation to the central government for a comprehensive consideration. I didn't say that the State Council would announce the appointments at the same time, or that I would make a recommendation at the same time. Thank you. Lady in black.
From the SCMP.
Oh, sorry, could you speak louder, please?
A few questions from the SCMP. So only 19 people were vaccinated under the at-home vaccination scheme. Is it far below the government's expectation? And the second question is, the government has said the Chinese medicine experts from the mainland have formulated plans for the use of Chinese medicine at home, diagnosis, rehabilitation, and as well as prevention and treatment. How will these plans be implemented, and what are the details? And the last one is, a new team of mainland experts has recently arrived in Hong Kong, And it was mentioned that they will offer guidance on Hong Kong's anti-epidemic work. As Hong Kong's number of infections have been gradually dropping, what will be their focus of the guidance? Thank you.
I'll invite Secretary for Civil Service to respond to your question about this pilot of conducting tests the vaccination for elderly people during the RTD, that is restriction testing declaration. And then I'll invite the Secretary for Food and Health to give you more details about the mainland experts, especially the plans proposed by the Chinese medicine experts. But before I hand over to my two colleagues, I just want to use this opportunity to express my deepest gratitude to the central government for sending us successively 5 batches of mainland experts. Other than the 5th batch, which only arrived yesterday, I have personally met with each and every of the 4 batches of mainland experts. I am very, very impressed by their understanding of a Hong Kong situation after spending maybe a week or 10 days going around our various facilities, sitting down to talk to our experts and our officials, and come up with very pragmatic measures that will help us, ranging from the treatment of critically ill COVID-19 patients to the use of Chinese medicine, and even to the use of RAT. One of the suggestions is having regards to Hong Kong's situation and a large number of cases we still had about 2 weeks ago. Professor Liang Wannian gave us this very good advice that since Hong Kong people were now very used to this rapid antigen test, and which is very less labor intensive and very economical, very easy to do, the Hong Kong SAR government should more progressively promote the use of this rapid antigen test instead of in order to identify as early as possible the infected cases in Hong Kong. So I just want to put on record that we should all appreciate these very pertinent advice coming from the mainland experts, and we will continue to do so, not only in fighting the COVID-19, but also in other longer-term curative and preventive work, including the promotion and development of traditional Chinese medicine in Hong Kong. Secretary for Civil Service.
Well, the pilot scheme on home vaccination was targeted at the buildings that were subject to RTD operation. And through the pilot scheme, we came to understand the number of elderly, age 70 and or above, or those persons with disability that are unable to get vaccinated through other channels. So the number is small, that's expected. For example, one of the buildings that I visited, 25% of the residents got infected. Most of the residents got vaccinated. And we could identify ranging from 4 to 6 persons per building that we can provide these home vaccination. But these provide us a very useful operational experience in the logistics, in the flow, in all the arrangements. And also, most importantly, if not for this home vaccination arrangement, these elderly or persons with disability would not be able to get vaccinated. So despite that it's a very labor, resource-intensive exercise, I think it's very worth doing it because we hope to see each and everyone, particularly the vulnerable groups, to get vaccinated as early as possible. But then with the online platform for registration to be launched later this month, we would expect much more registration coming on. And then we would arrange the outreach medical team to do the home vaccination.
Secretary for Food and Health. Okay, thank you for your 2 questions about the experts. First of all is the Chinese medicine experts. The Chinese medicine experts have given us, very good advice in terms of fighting the epidemic situation in Hong Kong. for the different types of patients that we have right now. Secondly, they have also provided some treatment protocols, a total of 4 treatment protocols to us for further implementation. We have organized an exchange meeting for the experts to introduce these treatment protocols to the Hong Kong Chinese medicine community, and they were well accepted. So what we are going to do is we will first of all disseminate these information about the treatment protocols. And secondly, the treatment protocols are to be implemented for different types of people. For example, one of them is a set of question and answer for the general public in using Chinese medicine. Another protocol is for the recovered patients, how to provide treatment and also medicine, Chinese medicine for the recovered patient. Third is for people who are staying at home, who are confirmed cases or close contacts who are staying at home. And finally, another proposal is for those who are staying in the community treatment, community isolation facilities, the CIF, both the holding centers as well as the CIF at large in general. So we will be, as these platforms are already there, and also the Hong Kong SAR government is already implementing the Chinese medicine for different people staying at different places in terms of prevention, treatment, as well as rehabilitation. We find it not difficult to actually implement. In fact, it is very easy for us to further implement these treatment protocols, as well as taking it forward. So this is one. Another, I think, interventions that the experts have done is one of the experts are actually working side by side with our Western medicine doctor in the AWE Community Treatment Center. And so they are seeing the patients, looking at and having case conference together, giving Chinese medicine as well as reviewing the progress of these cases, together. So according to them, I think the treatment that has been given so far has been very effective, and the patients are responding well to these. And this group of experts have also met with those Western medicine doctors in the hospital authority that look after more severe cases and understand more about our cases. So I think what they have been providing to us in terms of recommendations for the development of Chinese medicine in Hong Kong, as well as how best to fight this epidemic, and also how to use better use or increasing the coverage of using Chinese medicine in COVID-19 has been very, very useful, and therefore we are working on the implementation details. Secondly, about the new group of the 5th batch of experts, they are epidemiological type of experts, and generally on providing advice to us on prevention and control of the epidemic situation right now. We all understand now we have hit the peak of the epidemic situation, and the number of confirmed cases are reducing. But still, we have over 2,000 cases every day. So at this point in time, I think these experts will come. These experts have arrived, and we will be having a meeting with them later this afternoon. We will discuss the latest situation, and they will provide look at our current numbers, data, and provide some analysis and recommendations to us. And we'll continue to work with them in the current state of epidemic situation in Hong Kong. Thank you.
好啦，今日嘅記者會嘅時間差唔多。
That's it for today. I'll see you tomorrow at 11 o'clock. Thank you all very much.